big week in cardiology this week for the Cardiology Countdown. We have a meta-analysis in the European Heart Journal looking at the benefit of routine PCI following thrombolysis for ST elevation MI, looking at a total of 6 studies, finding a significant reduction in death, MI, or recurrent ischemia in those who were sent routinely within 24 hours for cath and PCI following thrombolysis. This is driven by a nearly 50% reduction in recurrent MI and recurrent ischemia, but not a significant difference in mortality. As such, this has been incorporated into the guidelines based on individual trials where a routine early strategy is recommended for high-risk patients, and this meta-analysis really supports that with all the evidence. At our number 2 spot this week is a very hot topic of the proton pump inhibitor and Clopidogrel interaction. There's an ACC, AHA, and ACG combined guideline document that looks at the current evidence now that the one randomized trial, Cogent, is published. And they find that use of a PPI with dual antiplatelet therapy, aspirin and Clopidogrel, is now an appropriate treatment for those at high risk of GI bleeding. It was seen that the proton pump inhibitors will reduce GI ulcers and GI bleeding, and that the evidence for cardiovascular harm and an interaction between Clopidogrel and PPI has been very scattered and not consistent in the literature, and actually refuted in the one direct randomized trial, Cogent. And as such, the recommendation is to risk stratify, and those who are at high risk for bleeding are now recommended to get a proton pump inhibitor. And conversely, those at very low risk of GI bleeding are not recommended necessarily to get routine use of a proton pump inhibitor. And thus, a big change, but nice to have a consensus document on this very hot topic. And at this week's number 1 spot is the paper in cholesterol treatment. It's the second cycle of the cholesterol treatment trialists collaboration. Now, this is more than a meta-analysis. It's a patient-level data of all of the statin trials combined into one that look at the world's literature in statin treatment. Now, this cycle adds the 5 trials, and co-published as the 5th, the SEARCH trial of high-dose versus standard-dose statin therapy. And what is seen in the overall meta-analysis and collaboration is that the high-dose versus regular dose will reduce major coronary events by 15%. Now, there's a non-significant 7% lower risk of death, but all the non-fatal events are significantly reduced, notably MI and stroke, and the need for coronary revascularization. And then looking at the statin versus placebo and the high dose versus low dose, they find very consistent findings for the degree of LDL lowering translating into the degree of benefit. And as such, they also find no harm with no increase in non-vascular death and no increase or decrease in the risk of cancer. And so this huge study of over 170,000 patients reaffirms the central role of statins and cholesterol lowering in preventing cardiovascular events. So with this week's Cardiology Countdown, I'm Chris Cannon.